Hey, it's Nate with Pulse PEMF and the Pulsecast, and I have been eagerly waiting for this interview for quite some time, and you're all about to find out why. Today's guest is none other than the legendary Dr. Cedric Noel, who is certified in chiropractic neurology, nutrition, childhood development disorders. You're a father, you're a dad, a hockey player, which we're going to talk about in a little bit. But to a lot of your clients, I'd say they would call you a hero
Mm.
for the work that you do. And so thank you so much for joining us on the Pulsecast.
Well, thank you for having me. It's an
Absolutely.
honor.
It's an honor to have you. You're doing incredible work here in Roswell, Georgia. And we're going to talk about your practice in a little bit. But I did want to start with one of the first things that I noticed about you when I met you last year was that you just have this humble passion to help people. You're actually grateful for the opportunity to help people. And that's rare. A lot of people just see it as a job, as a vocation, but it was very clear this is more than that to you. Was this something that you knew from a childhood that this was the industry that you wanted to go into to help people and overcome?
Absolutely.
Oh,
Yeah.
okay.
I feel like this is what I was made to do. This is
Wow.
my God create calling. He
You're in
called me to do it
destiny mode.
100%. Yeah.
I love it.
And it wasn't always that clear. So from childhood, yes. I mean, I was born with a congenital heart defect. And so from a very early age, my parents knew that at some point in my life, I would have to have open heart surgery to repair my heart.
Wow.
And for me, what that felt like is any time that I would exercise, it felt like my heart was going to just explode. So the blood just was pooling in there and it couldn't get out. I had aortic valve stenosis. So the oxygenated blood in the heart couldn't get out fast enough to supply my body with oxygen.
Wow.
And so the reason why that situation really carved my path in healthcare is because even though as a chiropractor, it's not like I'm a surgeon, I don't repair hearts. That saved my life. Medicine saved my life. Cardiac surgeons saved my life. And so the reason, though, I got into the field that I'm in now as a chiropractor and then learning functional neurology and teaching it and practicing it is because as a patient, a cardiac patient whose life was saved by a surgeon twice, I had two surgeries, um, is because I really wanted to know, and I asked those questions to the surgeon, what can I do to maximize my health, my function? What are the things that I can do now and forever to ensure that my level of function is at its best? And there was no answer other than take these medications. And I don't blame
Yes. But that
the
was a very
medicine.
discerning question for you
Yeah,
to ask.
I realized in my teens that it was not their specialty.
Mm,
They were great at what they did,
yes.
and they saved my life. But I wanted to focus on what do I need, what can I learn, what can I do to get these answers for myself, and then to bring those answers out for others. And my journey began as a strong interest in nutrition
Mm,
because that's something that we do every day, right? We put stuff in our body daily, and I knew that my diet was not good. I just didn't know what good was, you know?
right. I'd say that's most people in
Like,
America right now.
so if we get to make a decision, is what we consume good for us or is it harming us? So is it building health or is it taking away health? I wanted to understand that. So I got a bachelor's degree in nutrition.
Okay.
And then I decided, well, I know I don't want to be a surgeon, not because I don't love them. I love surgeons. They
Yes.
saved my life
Come on.
many times. Yeah.
Many lives. Yes.
But I wanted to fill a need that was not being filled. I
Mm,
wanted to understand, how can I answer my own questions, not just for myself, but for others. And so that led me to chiropractic. Because
mm,
chiropractic is a field where there's a very strong focus on helping the body heal itself and also investigating when the body is not healing, where's the interference and how can we remove that interference and help the body heal itself?
yes.
We're created with bodies that have self-healing abilities. Unfortunately, there are many things that get in the way of that. And I
Mhm.
wanted to learn what are those things. And so that's how my journey began as a chiropractor. And really, pretty early in practice, I realized that what I knew was nowhere near adequate. I didn't know enough because there was too many people that I was seeing that were not succeeding, that were not responding, that were not getting better, and I didn't know why. And so that's what led me to get into chiropractic neurology, also known as functional neurology.
Yes.
It's a specialty that we can certify in as chiropractors. It's a post-grad specialty. And my journey, I'd say, began because it is a lifelong of dedication to study. It never ends,
That's
and it
right.
constantly goes on. And so it's a tremendous amount of time, energy, resources, money, all of those things that we invest to help our patients. Yeah.
I appreciate the shout out that you gave to surgeons for saving your life. And so I want to give a shout out to chiropractors because chiropractors saved my life and what I was going through in 2018. So it's awesome to see doctors in their specialties doing what they do. And so thank you for
Mm.
all the work that you're doing here. And I know we're going to get in a minute into some of the people that you've been helping. I want to hear some of those success stories, those
Mhm.
comeback stories. But while we're talking about how niche that you've gotten your focus on education, the specialties that you are now developing, I mean, there's a whole method that we're going to dive into in a moment that has really come out of your journey of just kind of following it sounds like you're just following this trail of crumbs almost like you're starting in
Mhm.
nutrition, you're like, okay, now the next thing becomes a little more clear. How did it get even more niche? Because it went even deeper than just chiropractic neurology, right? Because
Mhm.
now you have a special facility that specializes in brain and body and rehabilitation.
Yeah, well, that's a great question because I first want to say that helping people restore health today is not exactly how it was 20, 30, 40 years ago. And so, and I say that because I find that in general, people are sicker today. They're harder to help. The level of toxins in their systems, and whether it be uh, air they breathe or food they eat, or really what we're exposed to from an energy perspective,
Yes.
the amount of electrical magnetic fields in our environment are forever, seems like forever increasing,
Right.
and so our body is having to adapt for so many stressors that we really didn't have before, not that long ago. I mean, I didn't even have a cell phone, in college,
We're
so
literally a generation that's being experimented on. They don't
yeah,
know long term what all of this is doing. They're just kind of making it up as they go, and we get to be along for the ride. You're
yeah,
absolutely right.
yeah. So to answer your question, the reason why is because of the people that I can't help. If I,
Mm.
it's the ones that I don't succeed with that really drive me to understand why. What else can I do? What else can we change? And so that's why we have the team that we have here, because there are some specialists that sometimes we can't all have the answers by ourselves. We need other team members that have a specialty that can be added to the service that we're providing to the patient. But we all have this common understanding that the central nervous system runs the show,
Right.
and everyone on our team understands that, and that's critical. But how we help a different individual can vary greatly depending on how they're presenting and what their needs are. But we have that flexibility of understanding that, hey, what worked for this person might not work for that one. We may have to shift things around. But ultimately, the answer to your question is it's when it doesn't work that drives me to try new things or try to understand what's missing or what am I not doing. And sometimes I don't get the answer, maybe ever. But
Hmm.
sometimes the answer comes years later. And I don't tend to forget the cases, that I can help. Those are the ones that I attach new ideas to when I
Yes.
think through what else can we do. And that's what's really driving me to create and invent and try day to day. Sometimes I'll think of something new in the moment and be like,
Yeah.
I feel like I need to do this.
Yes.
And it makes sense to do it this way.
I love your heart because out of the abundance of the heart, the mouth speaks, right? So
Hmm.
your heart is on full display right now that you're not settling with if you can't help someone, you're just not going to be like, well, sorry, nothing I can do for you. You own that, and you're trying to better yourself, which led you to develop this amazing team that's at this facility. How did you find all of these amazing specialists, and how did you like strategize this internal network?
Yeah. So, I'd love to take all the credit, but I can't. I do feel like the idea was in my mind for a very long time, and the
Yes.
pieces were the next steps were revealed to me in time. It took a long time. I mean, I've been in practice 23 years, and I was dreaming of something like this before I started practicing. It took me 20 years of practice to really get to a point where I feel like I really understand neurology. I understand the
Mm.
tools that I have and how to use them. It took me 20 years to get there.
Crawl, walk, run.
It's crazy. Yeah.
But
So,
it just goes to show, because there's so much in the education system and even on social media that's telling this generation to come up like you can be an overnight success, and that's just not the case in most. And here's a perfect example: if you want something that's really going to matter, you got to put in the time and the work and be patient with the
yeah,
process.
I totally agree. I always knew that I was called to do this, what I'm doing right now. I didn't know when I'd be able to do it the way that I'm doing it now. I didn't know when I'd be able to succeed with it. I knew I would. I just didn't know how long it would take.
Mm-hmm.
And I was okay with that. And it was not an easy road. But in terms of the team that we have, I feel like they were brought to me. I'm a believer in God, and I pray daily, and I ask for Him to guide me, and He's done that in time. It was not overnight, because if all this had happened 20 years ago, it would have crashed. I just wasn't ready for it.
Yep.
So I had to be prepared through many different seasons to get to this point. But I do feel like our team members were brought in at the right time. That ultimately, I think, was the most important step. Is one, I had to be ready, and when the right person was ready to be part of our team, it feels like people and God through people brought them to me, where I got to meet them, whether it be Dr. Ben or Melody or Dr. Bach. We have our specialties and our different skills and talents, and they were the right people to make this team. And it was easy to recognize when we met.
One thing I've noticed about the industry right now is that people carry the same heart as you. They just want to help as many people as possible, but they end up almost taking on like a savior complex. Like, I've got to become an expert in everything. So I love that you're distributing the responsibilities and the specialties within this facility and the network so that you can all collaborate together, and then it's a shared win at that point. So as you're having all of these experts and specialists and this amazing team come together, when did Pulse PEMF become a part of the picture?
It actually came in. I was introduced to it before this facility, before this team was together. This is back when I was in a small office. I was doing my thing on my own. I was the one man kind of. I was practicing with other clinicians that had different specialties, but I was just doing all my stuff by myself on my own
Okay.
in a very small space.
So we've been with you for a while.
Yeah, yeah.
I love it.
So what happened is I went to a conference, and months before that conference, PMF was there, but months before that conference, I had dislocated my shoulder. And so I had shoulder pain that was chronic. And I saw and I owned a PMF, like a low intensity PMF machine,
Okay.
for a long time, probably 12 years before that. I still have that same device in my home. And I thought that low intensity might be the best way to go, but I hadn't really experienced the high intensity one. And so during break at this conference, I decided, I'm going to go. Let's just see what he can do for my shoulder. And I did maybe 5 minutes on there. Class was starting. I had to get off and get back in course. So I did 5 minutes that first day, and I felt like this was interesting. Like I could feel the energy go right where the chronic pain is. And it didn't take the pain away after 5 minutes, but I felt like something was happening. I didn't know what it was, but I liked it. Like it made me feel like I want more of that.
Yes.
So the next day, I came back and I said, you know what? I'm going to give it a full shot. Like, how long should I do this? And we did 30 minutes. So I did 30 minutes, 20 to 30 minutes on my shoulder. The pain went away and it never came back. Never. So this is, I
Wow.
think it might be 2019. So, 2019. And then I thought, I need to have one of those. Like, I've got to have it. And I asked about the cost, and I thought, I can't do that. I need it, but I can't afford it. So that was my mental space at the time.
Mm-hmm.
And then a month or two goes by, and I'm realizing there's plenty of people I'm seeing that I'm failing. And I know that if I had that machine here, it would really help them. And so I went back, called the rep, and called him, and I said, you know what would it, how much would it cost? Like, I'm trying to work the numbers. I know we're not here to talk about the cost, but that was my main stumbling block. I had to get over like the cost of the device. And I realized that the monthly expense was completely doable. Like all I need is like one person or two people that are willing to use it. And it's a no-brainer. Like
And it's paying for itself at that
truly
point.
paying for itself. But what was most exciting to me is that not only does the machine pay for itself, but it sells itself. Like I'm not trying to sell anybody on it. I'm just letting them know that you try it. If you like it, you can use it. That's
Come
really
on.
all it is. And so I called all of my patients that had problems that I was not able to solve. All of them. I said, come on in. You could try it for free for the first time. And I gave them like an ultra low price. You can do 3 more for like close to nothing. And within a week, the month was booked out because people were getting so well so quickly. And they're like, I want more of that.
And you were doing no marketing.
0.
So this was just all word of mouth.
Overnight. Well, I mean, the only marketing I did is I reached out to patients that I knew I had not succeeded with. And that's what I did. And I blasted out a text message, email messages, and called some.
Do you remember what that said? Like, I've got a new technology.
Yeah,
I just need you to come
totally.
try.
The day I got it, I put it on the floor, the bed, the pulse bed,
Yep.
the contour bed.
Yep.
It was on the floor because I didn't realize I had to get a table to put it on. Like it came in, I opened it all up, and I shot a video in the dark. There's like a dark room on the floor, poor quality. The whole thing was poorly done. But the message was, this is what this thing did for me. And if you've been here and I was not able to help you, you need to come back in and try this thing because it's amazing. And I shared a story too of using it with because I use it on my kids. So I had one of them come in. One of them got an injury and I put him on it and he got up and goes, this thing really works. I can tell you lots of stories of my kids getting injured and getting up off that table or the pulse and feeling so much better. But that video is what I did. A month later, I had to buy another machine.
Wow.
I had to, because their schedule was full.
I didn't know that part of your story.
People were getting on plans. They were pre-purchasing, and they couldn't get on the schedule because it was full. So I bought a second machine.
Wow.
And that one I paid off within 2 or 3 months. And so the first machine was on like a monthly plan. I financed it, and it just finished actually last month or a month or 2 ago. I'm like, I'm going to go slow, the lower monthly cost possible, and I'll take my time. I have 4 machines now, and the first one just finished off. So 3 of the 4
and
paid off.
tons of accessories.
Lots of accessories.
An entire room devoted to Pulse.
Yeah. So I can go on forever in all sorts of stories like that, but Pulse was critical because for me, it allowed so many of my failed cases to succeed. I mean, and it did that on its own. So people tell friends and families about it. I have neighbors in my neighborhood that own it. I have patients all over that own the machine. Again, you think, well, why would you encourage your patients to buy it if they can come to your office and pay for the service? It's never been about that for me. I want people to get well. And if they want a device like that, even though they're not going to come here and pay for the service,
Mm-hmm.
it's good for everyone. It's good for them. If it makes a huge difference in their life, they're going to refer people to you.
Yes.
And they're still going to come and see you. They're still coming in. They don't need Pulse because they have their own, but
Right.
they still need the doctor, so it's a good thing.
I love that you just stepped right into it without. It just goes to show that the technology doesn't need a 6-month training program. It really is a plug and play, for lack of a better term. It's a plug and play system. You plug it in, you turn it on, and it works wonders for people.
Yeah.
And it doesn't require you to have to become this expert or specialist. You don't have to go through months of training to be able to get incredible results from people. So did you go through any training at all? This was how long ago? So I'm not sure where our training was at that point.
There was a training online, and I did go
Yeah.
through that.
Okay.
And that was helpful because it gives you an idea of like who should not use it.
Right.
What are the contraindications?
Mhm.
And that's really important. But ultimately, the more that I personally use it, the more I can appreciate and understand what it can do. So I think that may be the biggest, most important step is as a clinician, as a doctor that sees patients and uses it on patients, you've got to know what it feels like. You've got to experience it yourself. If you can do that, then you'll be a lot better at kind of molding the plan for your patients. But also understanding that when it doesn't work as expected, you may have a greater understanding as to why and how to troubleshoot it. Because there are situations where, we need to make some changes to the settings
Mhm.
or how we use it for that patient. And over time, the more experience you gain, you can see that before it even happens. But that's normal. It's like anything. Yeah.
100%.
Yeah.
I'm going to scoot to the edge of my seat because I've been waiting for this question. I'm so excited to hear the story behind how you developed the gravity reset method. Now, this was a concept that is now become a method that's used around the world, and you're annually teaching how to do this method. And Pulse played a huge role in how this whole method was developed and the success that you've had with countless clients. Could you tell us how it went from a concept to a method and how Pulse played a role in that?
Absolutely, yeah. As a chiropractor that has a specialty in neurology, we've been working with the brain I've been working for the brain for a long time and learning from amazing teachers all around. My personal journey in functional neurology was very long. Like I went through what felt like 2 decades of time learning as much as I can, try to apply as much as I can, and getting very mediocre to minimal results. And I know there's amazing success stories in there, but like I didn't want 25% success or 50%. I wanted 90 plus, if
Come
I can
on.
get that.
Yes.
And it's interesting because I really early, it's in 2010 is when I took my first vestibular rehab course. But I realized at that point in time that the vestibular system was very powerful and we can leverage it in a way that can benefit everybody. The how is what took a really long time to come together. And ultimately, I feel like this is the best way I can explain it. I feel like at some point it was revealed to me that with all that I had learned, how to piece it together in a way that was very powerful. Literally the most powerful application that we can use in neuro rehab for all patients. This is something that can be applied and offered to every human and quite a few dogs too.
Come on.
Yeah.
Yes, we have a whole animal line of products
I know,
for a reason. Yep.
I've got the benefit of helping a few dogs last year with vestibular issues, but
Wow.
ultimately, it's not something I market. We have receptors in the brain called the gravity receptors. Okay, there's 4 of them. We have 10 motion sensors, but of those 10, there's 4, so 2 on each side, that are gravity receptors, the otoliths, and they respond not only to gravity, but linear movements, like up, down in an elevator, front and back in a car, escalators, those kinds of movements. The reason why those receptors are so powerful is because they never stop working. Whether you're moving or you're not moving, they are the static system that make you aware of where you are in space based on gravity. It's so powerful.
That is incredible.
Now, what's crazy is that in all of the years of neuro rehab, there is really not little to none mentioned of how to leverage them therapeutically. Now, they were mentioned, we learn about them. But how do you use those receptors in therapy that is specific for each individual? And I feel like I was entrusted with that information because when it came together here in clinical care, the results were immediate, they were massive, and they became very consistent. And so from the year of 2022 to today, I've been looking at this system and trying all sorts of different ways and enhancing it and developing. And I have to credit a lot of my colleagues because I've had a lot of input as I've been teaching it. I've been learning from clinicians in the field that do this. So it's not all of me. It's been a collaboration of the entire cohort of clinicians that are learning and sharing their experience. So it's been a network. So it's been amazing. But I would say that this came about, again, it's those cases that are failed, but then as I learn and study neurology, I realized there's something important about these receptors. I also realized that I couldn't change balance and posture without activating them in some way. And I realized that years ago, I just didn't realize, I didn't know how to do it predictably and accurately and most optimally for each patient. And that's the gravity reset method. That's really what it is. It's a method that doesn't really take away or negate anything else that we're learning and doing because there's a lot of great things out there. The bottom line is that our human experience, our physical, mental, autonomic functions are built on this system. You take gravity away, just look at what happens. There's plenty of research on astronauts. You take away gravity, you do that long enough, everything goes down. You get depressed, your gut function decreases, your autonomic function, your motor control, everything goes. So they have to simulate gravity in space in order to not completely disconnect the body from that. But it affects you in every way. And there's shared pathways between the gravity receptors and eye movement control and so on. And so if that system gets disconnected, we can't survive it. That's how critical it is. And so that notion and those experiences is what really came together and was revealed to me as this is the critical piece that's been missing all these years. So this all came together as I've been working with the gravity reset method with all of my patients, no matter what they're in for. They can come in. I have one who had knee surgery. She had to have her meniscus repaired. So she comes in here to do her rehab. Well, we're using gravity reset methods within the knee rehab. We're using Pulse, PEMF. We're leveraging all these tools in an order in which allowed her to recover at record speed. And so where Pulse comes into this is my favorite way to use Pulse with a patient. Ideally, in most cases, and it varies again, it's not a hard mold, but gravity reset is restoring and optimizing your relationship with gravity.
I was going to ask you if you could summarize it in one statement.
That's what it is. It's recalibrating your brain's compass so that your awareness of where you are in space and where things are around you is sharp and accurate. And ultimately, it's enhancing the connection between the visual system, the vestibular system, which are those motion sensors in the inner ear in the brain, and the somatosensory system, which is feeling your body. Those three come together and allow you to know accurately where you are in space and where things are around you. Now, Pulse is an important piece, and I'm going to really touch on that. But ultimately, what allows an athlete to be in the game, to feel like they are part of their environment and they're completely connected with it, is those three systems being properly integrated in sync optimally. When you have that as an athlete, you can perform at a high level all the time, predictably.
Wow.
And so gravity reset is a method because it's not just a one way of doing things, it's understanding that concepts, it's leveraging some applications that we know and deciding which ones are we going to use for each patient at which time. Now, the cool thing about Pulse is that if we first reset the brain's relationship to gravity, and we do our other things, to help the body optimize its healing capability, and then we go on Pulse PEMF after that, and we shower the body with electrons to heal the cells and to optimize performance in those cells when you're fully calibrated, it's an absolute game changer. What I've been seeing in my practice is that patients recover a lot faster, like a lot. We went from months to weeks and days.
Wow.
Crazy. Yeah.
Exponential.
Exponential. Like they are different on day one. Now, I'm not saying everyone day one walk out the door and they're cured. I'm not saying that.
Right.
What I'm saying is they feel different. 90% feel better on day one. 90% objectively, I can retest before and after that first visit, and I can see a definitive change. They're better on day one.
Wow.
And so I now give myself a grace of 3 appointments, 3 visits. I want to see positive change in 3 visits, and we get it for about 90% of our patients. There's always exceptions. There's always situations where we're like, okay, it's just not going to happen in 3 visits. That happens. But for the most part, that 25 to 50% success that I was sharing earlier is at 90 plus now.
Mm-hmm.
And Pulse PEMF was a huge part of that because, of course, gravity reset is foundational. It was critical. I don't think any of this would happen in my practice without it. However, Pulse PEMF is my number one tool. It's my favorite. If I had one tool I could have, that's the one I would pick. And I'm not saying this because we're recording this. It is my favorite tool.
I believe you.
And so I'm on that thing.
I can see the excitement in your eyes.
Yes. And anytime my kids get hurt, I'm like, so what? I need to go on the Pulse machine now?
That's what they say in my house too.
Like,
Yep, exactly.
Are you going to tell me I need to go on that machine? Yes, you should. But yeah, it just kind of completes the care because we can guide it. Even if someone's here seeing Melody, who's our gut specialist, she loves Pulse machine. She'll tell you the same thing. We can also facilitate healing of the gut using Pulse. Now, there's something unique with Pulse, I think, and also, the fact that it's a high intensity machine and the quality of the engineering of the attachments that other devices don't have. And I've been on a lot of other brands. I'm not saying there's nothing else that's good out there. I'm just saying I think this is the best one because of the engineering of the attachments, So, and it seems like there's always new ones that every time we talk to you, tell me about new ones that I didn't hear anything about.
Yes,
so.
We love our accessories. We want to make sure we can target any area in the body.
Yeah. Well, and so that's what's been a game changer for me because I had a PEMF device for 10 years before my shoulder injury. I had chronic low back pain. I had a shoulder injury that wasn't getting better. And I can tell you right now that all of it has been gone for years.
Wow.
Now, Pulse was a critical part to that. Again, it's not the only tool I use, but it was the one tool that's allowed for a lot of that to happen. Now, when it comes to gravity reset, and another important thing that Pulse PEMF does is I mentioned that there's 3 systems, that come together that allow you to know where you are in space and where things are around you. And so one of those systems is called the somatosensory system. It allows you to feel, or people know the proprioceptors. There's receptors in your joints. There's receptors in your skin. There's different kinds of receptors that allow you to feel your body. That's one of the ways that I think, not the only, or one of the most important ways that pulse is an absolute game changer, because it's so powerful that you can not only feel the pulse where it's applied, you can feel it inside your body. I mean, to feel the inside of your abdomen, your gut, to feel the inside of my shoulder when it was injured. So, yeah, the energy that goes through is healing the tissue, the cells, but feeling the inside of your body is remapping your brain.
I didn't even think of that.
And that's huge, because if you can remap your body from the inside out, then your ability to be aware of where your body is
Spatial awareness increases.
changes. And that is reset throughout the day constantly. It's constantly reset. So when you have an injury, automatically your mapping system changes. Your awareness of that injured limb changes. The way you move, the way you perceive yourself and your environment changes. All those changes happen. And so if it's not properly remapped, even though the injury is healed, you can very easily get re-injured, because your brain's mapping and awareness of that limb or that joint, that area of your body is not sharp, it's not accurate, it's not efficient. So when you go to move it, it's not going to move efficiently.
That
There's
makes
going to be
sense.
more friction in that joint.
Yep.
There's going to be less stability in that joint, more stiffness. All that changes with Pulse PMF, because now all of a sudden you can actually remap your body with it.